Hi there, and welcome to A&P with Dr. O. We will discuss anatomical directions in this video. To help us visualize anatomical direction, we're going to use this figure from the Anatomy and Physiology OpenStax textbook. Let's start up here at the top. And up here at the top, we are going to use the term superior, which means above. And then if we move down from superior and we go below towards the feet or at this lower level, then we have inferior. And we can use this terminology to compare two different structures. The eyes are superior to the nose. The chin is inferior to the mouth. We also have the front side of the body here versus the back side of the body. If we're talking about the front side, we use anterior. And if we talk about the back side, we use the term posterior. For example, the lumbar landmark is posterior. That would be a way that we could use that particular term. Or the lumbar landmark is posterior to the umbilical landmark because the umbilical landmark is anterior. We also have medial and lateral. Medial is when we are going to be closer to the midline. And then when we move farther away from the midline, then we use the term lateral. For example, the nose is medial to the eyes. The ears are lateral to the nose. Again, a way for us to compare two different structures using directional terminology. We also have some terms that we use mainly when we're focusing in on the limbs. So here we have the lower limb, here we have the upper limb, and those terms are proximal and distal. And proximal is when we are closer to what we call the attached base. The base is the trunk, and then the arm attaches to the base at the shoulder joint. The leg attaches to the base at the hip joint. Closer to the attached base is proximal. Therefore, that shoulder joint and hip joint are proximal. The farther away you get from the attached base, that is going to be distal. Again, we can compare two different structures using this terminology. Let's see, we want to compare the elbow to the wrist. The elbow is proximal to the wrist because the elbow is closer to the attached base. The tarsal landmark is distal to the patellar landmark because tarsal, the ankle, is further away from the attached base. We also have some other terminology that we can note the definition of. Superficial. This is going to be at or close to body surface. And then if we have deep, that is going to be towards the interior of the body, farther away from body surface. Again, if we use this terminology in a sentence, the skin is superficial to the muscles. The muscles are deep to the skin. We also have ipsilateral and contralateral. Ipsilateral is going to mean the same side of the body. And contralateral is going to mean opposite side of the body.